Hey everyone, in this video we're going to be discussing about RMNCH plus A. So what is it about? So this is also known as the life package because of the components it covers in a women's life. It's a strategy based on provision of comprehensive care with 5 pillars. So here the R stands for reproductive, M stands for maternal, N stands for neonatal, C stands for child, and H stands for health obviously, and A is adolescent. So it's guided by central tenets of equity, universal care, entitlement, and accountability. So basically it means providing equal and universal care to all the women out there of reproductive age and adolescents and the newborn children. So here you can find this plus. So what is the significance of this plus? So here the plus signifies including adolescents for the first time as a distinct life stage. So this is because earlier it was an RCH, that means just reproductive and child health. So then it had phase 1 and phase 2, but right now it's RMNCH. So the plus is to include the adolescent stage, and then linking maternal child health to reproductive health, family planning, adolescent health, HIV, gender, preconception, and prenatal diagnostic techniques. So then for linking different health facilities to the maternal and child health, and then linking home and community-based services to facility-based care. Then ensuring referral linkages and counter referrals between and among health facilities at primary, secondary, and tertiary levels. So basically linking and referring of different cases and integrating all the levels of healthcare. So what is the aim of RMNCH? The aim is to reach the maximum number of people in remotest corners of the country through a continuum of services, constant innovation, and routine monitoring. So you have to reach the underprivileged population, whoever are not receiving the services, and provide them all these facilities available. So the goals. So there are 3 primary goals of RMNCH. There are just 3. So the first one is reduction of infant mortality rate to 25 per 1,000 live births by 2017. Then reduction of maternal mortality rate to 100 per 1 lakh live births by 2017. And then reduction in total fertility rate to 2.1 by 2017. Though they have not been achieved by 2017, we're still striving hard to achieve them. And maternal and child health has always been an important sector for, telling about the progress of the nation and the development of the nation. And it has also been included in one of the Millennium Developmental Goals. So the key targets set to achieve these goals of RMNCH plus A are to increase the facilities equipped for perinatal care, to increase the proportion of all births in government and private institutions, that is increasing the rate of institutional delivery, increasing pregnant women receiving ANC, increasing mothers and newborns receiving PNC, increasing deliveries conducted by skilled birth attendants, that is trained dais and other skilled people, and increasing exclusive breastfeeding rates, decreasing prevalence of underweight in under 5 children, and increasing coverage of 3 doses of DTP, that is the vaccine, the trivalent one, the increasing ORS in under 5 children with diarrhea, because malnutrition and diarrhea have been one of the most reasons of under 5 children deaths. Then decreasing unmet need of family planning methods among eligible couples, increasing met need for family planning methods, decreasing anemia in adolescent girls and boys. By this can be by Anemia Mukt Bharat program. There are many more provisions. Decreasing proportion of total fertility contributed by adolescents, and increasing child sex ratio in 0 to 6 years. So this summarizes or covers all the key targets that is to be achieved by RMNCH plus A interventions. So the interventions I'll be discussing now. So this is also called the 5x5 strategy. This is because it has 5 components, that is the reproductive, maternal, neonatal, child, and adolescent. Then each one of it has 5 more interventions to be covered in. So for first reproductive, we have the first one as spacing methods, the PPIUCD at high caseload facilities. Then interval IUCDs at all facilities on fixed days. That is in sub-centers, on fixed days you provide interval IUCD. Then HDCs and ESBs. HDC stands for home delivery of contraceptives, and ESB is ensuring spacing at birth through ASHA. Then access to PTKs, and that is pregnancy testing kits, the NICSHI kits, and strengthening comprehensive abortion services. Then a quality sterilization services. So maintaining quality sterilization services. This is about reproductive health. Moving on to maternal health. So here, the maternal health, the MCT is to ensure early registration of pregnancy and full ANC, that is the antenatal care. Then high risk pregnancy. So to detect all high risk pregnancy and line list of pregnant women who are anemic and who needs whoever diabetic, and provide the essential for them. Then equip all delivery points via highly trained HRs, that is the human resources, and equitable access to emergency obstetric care through FRUs, that is the first referral units. Then review maternal, infant and child deaths, because that's when we'll know how well the program is working and how much is improving. Then identify villages with high number of home deliveries and distribute misoprostol in the 8th month, which is to be instituted in the 3rd stage of labor. And also provide incentives to ANMs for home deliveries. So they'll go to the people and tell about the required sanitary measures, the importance of institutional delivery, and the care that needs to be taken before and after delivery. Then moving on to newborn health. So in newborn health, you need to promote exclusive breastfeeding, tell the importance, how important the baby needs to be breastfed in the first 6 months of life. Then HBNC, that is the home-based neonatal care. This is to be provided by ASHA. Then essential newborn care and resuscitation during any emergency. Then special newborn care units. This is to care the neonate immediately after the birth and provide immunization, vaccine, and to clean the baby and all. And then in community level, provide gentamicin by the ANMs. Then moving on to child health. So child health is all about providing supplements and completing immunization. So complementary feeding, that is proper weaning. Then IFA supplements, that is the iron folic acid supplements. Then for diarrhea management, because under 5 the most common is pneumonia and diarrhea. So for diarrhea we give zinc and ORS for children. Then management of pneumonia, full immunization coverage, see that the baby is completely immunized, given all doses at required time according to NIS, that is the National Immunization Schedule. Then RBSK, that is the Rashtriya Bal Swasthya Karyakram, where it focuses on 4 Ds and its management. So here the 4 Ds stands for developmental defects, deficiencies, then also birth developmental delays, deficiencies, then birth defects, the other D, and diseases. Right? So focusing on identifying all this and treating them. Then moving on to adolescent health. In adolescent health, you have to address teenage pregnancies and increase contraceptive prevalence, because this is when the reproductive age starts. So then peer educators. So you go community-based services. You go to schools and colleges and educate the children, peers, and there's so much peer pressure in adolescents. And then strengthen ARSH clinics. So ARSH stands for Adolescent Reproductive and Sexual Health Program. So strengthen ARSH clinics, where they educate the adolescents about the reproductive health, reproductive tract infections, and about sexual health. Then you also have roll out National Iron Plus initiative, that is providing weekly iron folic acid to adolescents, and also educate them about the menstrual hygiene, usage of sanitary pads and their disposal, and etc. So this is about the 5x5 matrix. So in this you also have something called health system strengthening, just to improve the healthcare provided and cross-cutting interventions. So in health system strengthening, you have the caseload HR, that is based on the caseload you need to improve on your human resources. Then providing ambulances, diagnostic and referral health services, and demand promotion also. So health education, demand promotion, and BCC, that is behavioral change communication. Then we have public grievances and client satisfaction, all around quality assurance. In cross-cutting interventions, you need to integrate the JSSK, RBSK. Different programs are included in RCH and RCH2. So integrating them to achieve what is desired. And quality care to pregnant women and children, and also reaching the underserved, underserved and the unserved villages and urban slums. So also introduce difficult area and performance based incentives. So this is all about RMNCH plus A, the goals, targets and interventions. So these are all the strategies. Okay. So thank you for watching this video. If you need any more videos in SPM, please do mention in the comment section below, and please do like, share and subscribe to One Stop Medicos, and see you there.